What are the primary indications and contraindications for joint mobilization techniques in physical therapy? Explain how clinical reasoning plays a role in determining the appropriateness of these techniques for a specific patient. Answer: joint mobilization techniques are indicated for conditions such as osteoarthritis, joint stiffness, and pain management. They can improve range of motion, decrease pain, and enhance function by restoring normal joint mechanics. Contraindications include acute inflammatory conditions, e.g., rheumatoid arthritis flare-ups, recent fractures or surgeries involving the joint hypermobility or instability, infections in or around the joint. Clinical reasoning involves assessing the patient's specific condition, history, and response to previous treatments. For example, a therapist might consider the patient's pain level, range of motion, and any radiological findings. If a patient with knee osteoarthritis has significant stiffness and limited mobility but no inflammation, the therapist may proceed with gentle joint mobilization, adjusting techniques based on the patient's feedback during treatment. Describe the principles of exercise prescription for a patient recovering from ACL reconstruction. Include specific types of exercises and the rationale for their progression. The principles of exercise prescription include overload, specificity, progression, and reversibility. Overload: the intensity of exercises should gradually increase to improve strength and function. For instance, after ACL reconstruction, initially the focus may be on isometric quadriceps exercises before progressing to isotonic exercises. Specificity: exercises should target the muscles and movements relevant to the patient's functional goals. For ACL recovery, exercises should emphasize the quadriceps, hamstrings, and proprioception. Progression: the rehabilitation program should advance in difficulty. For example, weeks 1, 2, isometric exercises, e.g., quad sets, weeks 3, 4. Open chain exercises, e.g., straight leg raises, weeks 5, 6. Closed chain exercises, e.g., mini squats, step-ups, weeks 7, 8. Functional exercises, e.g., balance activities, sport-specific drills. Reversibility: this principle reminds clinicians that without continued training, the benefits of exercise can diminish. Therapists should ensure a maintenance program is developed as the patient nears full recovery. Mr. Thompson is a 45-year-old male who recently underwent total hip arthroplasty. He presents to therapy with significant post-operative pain and limited range of motion. As his therapist, what initial assessment should you conduct and what interventions would you prioritize in his treatment plan? Answer: in this scenario, the initial assessment should focus on pain assessment. Use a pain scale to quantify Mr. Thompson's pain levels, range of motion, ROM, measure active and passive ROM in the hip joint. Functional mobility: evaluate how he transitions from supine to sitting and ambulation using assistive devices. Based on the assessment, the initial treatment plan should prioritize pain management. Employ modalities such as cryotherapy or electrical stimulation to alleviate pain. Gentle ROM exercises: initiate passive or assisted ROM exercises to prevent stiffness without aggravating pain. Patient education: instruct Mr. Thompson on precautions following hip surgery, e.g., avoiding hip adduction beyond neutral. As he progresses, the focus can shift towards strengthening exercises and functional mobility training. What are the physiological effects of therapeutic ultrasound and what are the specific indications for its use in a rehabilitation setting? Answer: therapeutic ultrasound works by converting electrical energy into mechanical energy, resulting in sound waves that penetrate tissue. Its physiological effects include thermal effects: increased tissue temperature promoting blood flow and reducing pain. Non-thermal effects: promote tissue healing through cavitation and acoustic streaming, enhancing cell membrane permeability. Indications for therapeutic ultrasound include soft tissue injuries, e.g., tendonitis, bursitis, scar tissue management, pain relief in musculoskeletal conditions, preparation of tissues for stretching and mobilization. Therapists should assess contraindications such as pregnancy, malignancy, and areas with impaired sensation before applying ultrasound. Why is patient education essential in the rehabilitation process, and what strategies can therapists employ to enhance patient understanding of treatment modalities? Answer: patient education is crucial for promoting compliance, managing expectations, and facilitating recovery. Understanding the purpose and effects of treatment modalities empowers patients to engage in their rehabilitation actively. Strategies for effective patient education include clear communication. Use simple language and avoid jargon when explaining treatment protocols. Visual aids: utilize diagrams, models, or videos to illustrate concepts. Involvement in goal setting: collaborate with patients to establish realistic and meaningful rehabilitation goals, increasing their commitment. feedback mechanisms, encourage questions, and provide opportunities for patients to express concerns, enhancing their understanding and trust. Discuss the process of assessing a patient for mobility aids and explain how you would determine the appropriate type of assistive device for an elderly patient with decreased balance. Answer: the assessment process for mobility aids involves several steps. Functional mobility assessment: evaluate the patient's ability to perform activities of daily living adults and their balance during standing and ambulation. Strength and range of motion evaluation: determine if the patient has the necessary strength to use various devices effectively. Cognitive assessment: consider the patient's cognitive status, as complex devices may be inappropriate for patients with cognitive impairments. For an elderly patient with decreased balance, the appropriate assistive device could be walker, provides stability and support, allowing for better weight distribution and reduced fall risk. Canes: if the patient demonstrates improved balance but still needs minimal support, therapists should also provide training on proper device usage to maximize safety and effectiveness. Explain the concept of specificity in exercise prescription and provide an example of how it might influence the rehabilitation program for a patient recovering from a stroke. Answer: the concept of specificity in exercise prescription refers to the principle that training adaptations are specific to the type of exercise performed. This principle is critical in rehabilitation as it ensures that exercises target the particular functional deficits presented by the patient. For a stroke patient, specificity might dictate that strengthening exercises focus on the affected side to improve unilateral strength. Functional tasks such as reaching, grasping, and walking are integrated into the program to replicate activities of daily living. Balance exercises are tailored to the patient's specific balance deficits, incorporating different surfaces and tasks to challenge stability. Incorporating these specific exercises ensures a more effective rehabilitation process targeting the patient's unique needs. MS Davis is a 60-year-old woman recovering from a total knee replacement. She expresses anxiety about her ability to perform daily activities and is concerned about pain during rehabilitation. How would you address her concerns, and what initial therapeutic interventions would you suggest? Answer: to address MS Davis's concerns, a therapist should first validate her feelings of anxiety and discuss the common experiences following knee replacement surgery. It's essential to provide reassurance that pain management strategies are in place. Initial therapeutic interventions may include pain management. Educate MS Davis about the use of ice and the importance of medication adherence. Gentle ROM exercises. Begin with passive and active assisted ROM to gradually improve mobility while monitoring pain levels. Patient education. Provide information on the recovery process, setting realistic expectations and discussing the importance of gradual progression in therapy. Using clear communication and involving MS Davis in her treatment plan will help alleviate her anxiety and empower her during the recovery process. What role does electrical stimulation play in the rehabilitation of muscle atrophy, and what types of electrical stimulation modalities are most effective? Discuss their indications and contraindications. Answer: electrical stimulation plays a critical role in preventing muscle atrophy, especially in patients with limited mobility or after surgical procedures. By inducing muscle contractions, it can maintain muscle tone and improve strength, facilitating recovery. Types of electrical stimulation modalities include neuromuscular electrical stimulation (NMES), used to elicit muscle contractions in innervated muscles to improve strength and function. Transcutaneous electrical nerve stimulation (TENS), primarily for pain relief. It can also indirectly support muscle activation. Indications for NMES include postoperative rehabilitation and chronic muscle disuse. Contraindications include cardiac pacemakers, pregnancy in the abdominal region, malignancies in the treatment area. How can understanding the physiological effects of heat and cold therapy assist therapists in educating patients about their use in rehabilitation? Provide examples of scenarios where each modality would be appropriate. Answer: understanding the physiological effects of heat and cold therapy allows therapists to tailor patient education effectively. Heat therapy promotes vasodilation, enhancing blood flow and tissue elasticity, which is beneficial for chronic pain conditions, e.g. arthritis. Pre-exercise warm-ups to prepare muscles. Cold therapy causes vasoconstriction, reducing inflammation and pain, making it suitable for acute injuries, e.g. sprains, to minimize swelling post-exercise recovery, to decrease muscle soreness. Educating patients about the appropriate indications and safe application methods, e.g. duration, temperature, and skin protection, empowers them to manage their symptoms and contribute actively to their rehabilitation process. What are the primary factors that determine a physical therapist's scope of practice in a given state, and how might these factors vary between states? Provide specific examples of regulations that illustrate these differences. Answer: the scope of practice for physical therapists is primarily determined by state laws and regulations, which define what physical therapists are authorized to do. Factors influencing scope include state practice acts, which may outline specific services PTS can provide, as well as restrictions related to certain conditions or populations. For example, some states allow PTS to perform dry needling or specific manual therapy techniques, while others may not. State regulations may also differ in terms of supervision requirements for physical therapy assistants, TOS, and the level of direct access a patient has to physical therapy services. For instance, in California, a PT can evaluate and treat a patient without a physician's referral, whereas in Texas, a referral is required for certain interventions. Understanding these regulations is critical for compliance and ensuring quality care. PTS should regularly review their state practice acts and stay informed about any legislative changes that could impact their practice. Discuss the ethical implications of confidentiality in patient care. What steps should a physical therapist take if they encounter a situation where they believe a patient's confidentiality may be breached? Answer: confidentiality is a fundamental ethical principle in healthcare, grounded in the idea that patients have the right to control their personal health information. Physical therapists must adhere to the Health Insurance Portability and Accountability Act (HIPAA), which outlines strict rules regarding the protection of patient information. If a therapist believes a patient's confidentiality may be compromised, they should take the following steps. Assess the situation. Determine the nature of the potential breach and its urgency. Consult policies. Review the clinic or facility's privacy policies and procedures. Communicate with the patient. If appropriate, discuss the potential breach with the patient to gain their perspective and consent for any necessary disclosures. Document the issue. Keep detailed records of the incident, including the assessment, actions taken, and communications. Report to appropriate authorities. If the breach is significant or involves legal requirements, it may need to be reported to a supervisor or legal counsel to ensure compliance with state and federal laws. MS. Lee is a physical therapist working with a patient from a cultural background that emphasizes family involvement in healthcare decisions. The patient, Mr. Gonzalez, has been hesitant to engage in his rehabilitation exercises. What strategies can MS. Lee employ to enhance cultural competence in her practice and improve Mr. Gonzalez's adherence to his therapy plan? Answer: MS. Lee can enhance cultural competence and improve Mr. Gonzalez's adherence to his therapy plan by employing the following strategies. Involve family members. Recognizing the cultural importance of family, MS. Lee should invite Mr. Gonzalez's family to participate in therapy sessions to discuss treatment goals and reinforce the importance of adherence. Culturally tailored education. She should provide educational materials that are culturally sensitive and available in Mr. Gonzalez's preferred language, ensuring that he understands the rationale behind his rehabilitation exercises. Active listening and empathy. MS. Lee should practice active listening to understand Mr. Gonzalez's concerns and motivations, demonstrating empathy towards his situation. This can foster a trusting therapist-patient relationship. Build rapport. Establishing a personal connection through open dialogue about cultural beliefs and practices can help Mr. Gonzalez feel more comfortable and supported in his therapy journey. Set collaborative goals. Working together to set achievable and meaningful goals that align with Mr. Gonzalez's values can enhance his motivation and commitment to the rehabilitation process. Explain the significance of SOAP notes in physical therapy documentation. What legal implications could arise from inadequate or inaccurate documentation in these notes? Answer: SOAP notes, subjective or objective assessment plan, are crucial for maintaining comprehensive patient records in physical therapy. They provide a structured format that allows therapists to document patient encounters clearly and effectively. The significance of SOAP notes includes communication. They facilitate communication among healthcare providers by providing a clear and concise summary of the patient's status and treatment. Continuity of care. Proper documentation ensures that subsequent therapists can understand the patient's history and ongoing needs, which is vital for effective treatment. Legal protection. SOAP notes serve as a legal document that can be reviewed in case of disputes or claims against the therapist. Inadequate or inaccurate documentation can lead to serious legal implications, including malpractice claims. Insufficient records may undermine the therapist's defense in a malpractice lawsuit, making it difficult to prove that appropriate care was provided. Billing issues. Incorrect documentation can result in improper billing practices, potentially leading to fines or penalties from insurance providers. Regulatory scrutiny. Inaccurate documentation may raise concerns during audits by regulatory bodies, risking the therapist's licensure and professional standing. Therapists must ensure that SOAP notes are thorough, accurate, and reflective of the patient's clinical status and treatment plan. What are the key differences between Medicare and Medicaid in terms of coverage, eligibility, and reimbursement for physical therapy services? Provide an example of how these differences might impact a therapist's practice. Answer: Medicare and Medicaid are two fundamental programs in the U.S. healthcare system, but they differ significantly in coverage, eligibility, and reimbursement. Medicare coverage, primarily for individuals aged 65 and older and certain younger individuals with disabilities. It generally covers physical therapy services under Part B when deemed medically necessary. Eligibility: patients must have paid into the system via payroll taxes for at least 10 years or meet specific disability criteria. Reimbursement rates are set by the Centers for Medicare and Medicaid Services (CMS) and often involve copies for services. Medicaid coverage, designed for low-income individuals and families. Coverage can vary widely by state. Some states may offer extensive coverage for physical therapy, while others may have restrictions. Eligibility: based on income and household size, eligibility criteria can be more flexible than Medicare, often including a broader range of services. Reimbursement rates for Medicaid services are typically lower than those for Medicare, and they can vary by state and specific service. Impact on practice: a physical therapist treating a patient eligible for both Medicare and Medicaid may need to navigate different reimbursement structures and compliance requirements. For example, if a patient requires extensive physical therapy due to a chronic condition, the therapist must be aware of the limits and requirements under each program, as this can impact the frequency and duration of therapy sessions authorized. In the context of informed consent, discuss the ethical obligations of physical therapists when dealing with patients who may have impaired decision-making capacity. What steps should a therapist take to ensure ethical compliance in these situations? Answer: informed consent is a critical ethical obligation for physical therapists, requiring that patients understand the risks, benefits, and alternatives to treatment. When dealing with patients who may have impaired decision-making capacity, therapists must take additional steps to ensure ethical compliance. Assess capacity: the therapist should evaluate the patient's ability to understand the information presented. This includes cognitive assessment and ensuring that the patient can express a choice based on that understanding. Use clear communication: therapists must communicate in simple, straightforward language, avoiding medical jargon to ensure that the patient comprehends the information. Involve surrogate decision makers: if the patient lacks capacity, therapists should involve legally authorized representatives or family members in the consent process, ensuring they have access to all relevant information. Document discussions: it is essential to document all discussions regarding informed consent, including the assessment of capacity and the involvement of family members or surrogates. Describe how understanding current procedural terminology (CPT) and international classification of diseases (ICD-10) codes is essential for physical therapists in navigating reimbursement models. Provide an example of a common coding error and its potential implications. Answer: understanding CPT and ICD-10 codes is critical for physical therapists, as these codes are essential for billing and reimbursement processes. CPT codes describe the specific services and procedures performed, while ICD-10 codes classify the diagnosis that necessitates those services. Key points include accurate billing. Correct coding is essential to ensure proper reimbursement from insurers. Errors can lead to claim denials or delays. Compliance: knowledge of coding standards is necessary to comply with regulations and avoid allegations of fraudulent billing practices. Data tracking: accurate coding aids in the tracking of treatment outcomes and service utilization, contributing to quality improvement initiatives. Common coding error example: a frequent error occurs when a therapist uses an outdated or incorrect ICD-10 code that does not accurately reflect the patient's diagnosis, e.g., using a code for low back pain instead of a more specific code indicating a herniated disc. This error can lead to claim denial. The insurance company may deny the claim due to insufficient documentation supporting the treatment. Financial repercussions: the therapist may face delayed payments, impacting cash flow and the financial viability of their practice. Increased audit risk: repeated coding errors can trigger audits by insurance providers, potentially leading to legal issues or penalties. Therapists must remain current on coding guidelines and ensure meticulous attention to detail in the coding process to mitigate these risks. What role do physical therapists play in patient advocacy, and how can they effectively empower patients to take an active role in their rehabilitation process? Provide specific strategies and examples. Answer: physical therapists play a vital role in patient advocacy by ensuring that patients' rights are respected and that they receive appropriate care. Advocating for patients involves educating them about their conditions, treatment options, and rights within the healthcare system. Effective strategies for empowering patients include education. Therapists should provide comprehensive information about the patient's condition, the importance of adherence to the rehabilitation plan, and potential outcomes of different treatment paths. For instance, using visual aids or educational brochures can help clarify complex concepts. Shared decision-making. Encourage patients to actively participate in their treatment planning. This could involve discussing the pros and cons of various therapeutic interventions and allowing patients to voice their preferences. Goal setting. Collaboratively setting achievable and meaningful goals can foster a sense of ownership over the rehabilitation process. For example, if a patient expresses a desire to return to a specific hobby, the therapist can design a tailored rehabilitation plan that focuses on skills needed for that activity. Support networks. Encourage patients to engage with support groups or resources that can provide additional information and emotional support. Connecting patients with others who have experienced similar conditions can enhance motivation and adherence. By employing these strategies, therapists can effectively empower patients, facilitating a proactive approach to their health and recovery. Discuss the importance of physical therapists working within interdisciplinary teams in various healthcare settings. How does collaboration enhance patient outcomes? Provide examples of successful interdisciplinary practices. Answer: collaboration within interdisciplinary teams is essential for delivering comprehensive care, particularly in complex cases involving multiple health conditions. Physical therapists bring unique expertise to these teams, focusing on movement, function, and rehabilitation. Key benefits of interdisciplinary collaboration include holistic care. By working together, healthcare professionals can address the physical, emotional, and social aspects of patient care, leading to more effective and personalized treatment plans. For example, a team comprising physicians, nurses, occupational therapists, and physical therapists can develop a unified strategy for managing a stroke patient's recovery. Enhance communication. Regular team meetings promote open communication among providers, facilitating coordinated efforts in patient management and reducing the risk of fragmented care. Shared expertise. Each discipline contributes specialized knowledge that can enhance treatment strategies. For example, a physical therapist may collaborate with a nutritionist to develop an exercise program that considers the patient's dietary restrictions, thereby optimizing recovery outcomes. Improved patient engagement. Collaborative approaches can enhance patient engagement by providing a more comprehensive understanding of their treatment plan, making them feel more supported and involved in their care. Successful examples include interdisciplinary rehabilitation programs for patients recovering from major surgeries, where PTS work alongside surgeons, anesthesiologists, and nursing staff to ensure a seamless transition from acute care to rehabilitation. Analyze how the shift from fee-for-service to value-based care models impacts the role of physical therapists in patient treatment plans. What challenges and opportunities does this transition present for therapists? Answer: the transition from fee-for-service to value-based care (VBC) models emphasizes the quality of care over the quantity of services provided. In this environment, physical therapists are required to adapt their practices to focus on patient outcomes and cost-effectiveness. Key impacts include outcome measurement. Therapists must utilize standardized outcome measures to demonstrate the effectiveness of their interventions, which may include tools like the Oswestry Disability Index or the Functional Independence Measure. Interprofessional collaboration. VBC encourages enhanced collaboration with other healthcare providers to develop comprehensive treatment plans aimed at improving overall health outcomes. Patient-centered care. Therapists are required to engage patients more actively in their care, focusing on individual goals and preferences. This approach can enhance patient satisfaction and adherence to treatment plans. Challenges. Documentation demands. The need for extensive data collection and outcome tracking can increase the administrative burden on therapists, potentially detracting from direct patient care. Reimbursement complexities. Navigating reimbursement structures in VBC can be complex, requiring therapists to stay informed about payer policies and performance metrics. Opportunities. Increased focus on quality. Therapists who excel in demonstrating patient outcomes may attract more referrals and enhance their professional reputation. Expanded roles. The emphasis on value-based care can allow PTS to take on expanded roles within healthcare teams, positioning them as essential providers in managing chronic conditions and preventive care. As the healthcare landscape evolves, physical therapists must adapt to these changes, leveraging the opportunities presented by VBC while addressing the associated challenges. A 45-year-old female presents with unilateral shoulder pain after recent fall while hiking. Upon examination, you note limited range of motion in the affected shoulder, tenderness over the acromioclavicular joint, and no signs of neurological compromise. What clinical reasoning process should you utilize to develop a treatment plan, and what red flags should you be aware of in this case? Answer: to develop a treatment plan, employ the clinical reasoning process by first gathering a comprehensive patient history and conducting a thorough physical examination. Based on your findings, consider the potential differential diagnoses, including acromioclavicular joint injury, rotator cuff tear, or shoulder impingement syndrome. Red flags to watch for include signs of fracture, e.g., severe pain, swelling, or deformity, neurological symptoms such as numbness or tingling, symptoms indicative of systemic disease, e.g., fever, unexplained weight loss. Utilizing this reasoning ensures you prioritize the most urgent conditions requiring immediate intervention, such as fractures, before developing a treatment plan centered around restoring function and alleviating pain. Discuss the importance of identifying contraindications in patient treatment plans and provide examples of common contraindications related to therapeutic exercise. Answer: identifying contraindications is critical to ensure patient safety and prevent exacerbation of existing conditions. Contraindications may stem from the patient's medical history, current health status, or specific diagnosis. Common examples include acute inflammation. Therapeutic exercises should be avoided in areas with acute inflammation to prevent further tissue damage. Recent surgery. Post-operative, patients may have restrictions based on the surgical procedure, e.g., no weight-bearing exercises after hip replacement. Severe cardiac conditions. Patients with uncontrolled heart conditions should avoid high-intensity aerobic exercises. Awareness of these contraindications allows physical therapists to tailor interventions that enhance recovery while minimizing risks. Mr. Anderson, a 60-year-old patient with chronic low back pain, expresses a desire to improve his mobility and reduce pain to return to gardening. As a physical therapist, how would you apply the SMART goal-setting framework to create an individualized treatment plan for him? Answer: to apply the SMART goal-setting framework for Mr. Anderson. Specific: define a clear and precise goal, such as Mr. Anderson will increase his range of motion in lumbar flexion to 80 degrees, and measurable. Establish how progress will be tracked, such as through a goniometer measurement of lumbar flexion. Achievable: ensure the goal is realistic given Mr. Anderson's current abilities and condition. If, for instance, increasing his lumbar flexion from 50 degrees to 80 degrees may be realistic over a specific time frame. Relevant: align the goal with Mr. Anderson's desire to return to gardening, making the goal meaningful to him. Time-bound: set a deadline, such as within 8 weeks, to evaluate progress and modify the treatment plan as needed. This framework not only enhances adherence but also ensures the plan remains patient-centered and outcome-focused. Describe the role of evidence-based practice in clinical decision-making and provide an example of how it can influence treatment interventions for a patient with osteoarthritis. Answer: evidence-based practice is integral to clinical decision-making as it combines clinical expertise, patient values, and the best available research evidence to inform treatment decisions. For a patient with osteoarthritis, BP might influence interventions in the following ways. Research. Studies suggest that exercise, particularly low-impact aerobic and resistance training, significantly improves function and reduces pain in osteoarthritis patients. Patient values. If the patient expresses a preference for non-pharmacological management of their pain, incorporating BP allows the therapist to present exercise as a viable treatment option. Outcome measures. Utilizing validated tools like the Western Ontario McMaster University's Osteoarthritis Index (WOMAC) helps track progress and adjust the intervention as needed based on the evidence of effectiveness. This approach ensures the therapy provided is effective, safe, and aligned with the patient's preferences. What are the key components of effective documentation in physical therapy, and how does it impact treatment outcomes? Answer: effective documentation in physical therapy includes several key components. Subjective information, details about the patient's symptoms, experiences, and personal goals. Objective data, measurable findings from assessments including range of motion, strength, and functional performance. Assessment: the therapist's clinical judgment about the patient's condition based on the subjective and objective information. Plan: a clear outline of the treatment interventions, frequency, and anticipated outcomes. Proper documentation impacts treatment outcomes by ensuring continuity of care, facilitating communication among healthcare providers, and providing a legal record of the care provided. It also supports reimbursement processes and helps track progress, enabling modifications to the treatment plan based on patient response. When analyzing clinical data from a patient with chronic pain, what factors should be considered to differentiate between nociceptive and neuropathic pain? Answer: differentiating between nociceptive and neuropathic pain requires a thorough analysis of clinical data, including pain characteristics. Nociceptive pain typically presents as sharp, aching, or throbbing, while neuropathic pain may be described as burning, tingling, or electric shock-like. History of injury. Nociceptive pain often correlates with a specific injury or inflammatory condition, whereas neuropathic pain may arise without an identifiable injury. Response to treatment. Nociceptive pain often responds well to analgesics and physical therapy, while neuropathic pain may require specific medications like anticonvulsants or antidepressants. Neurological signs. Assess for neurological deficits, such as weakness or sensory changes, which may indicate neuropathic pain. Understanding these distinctions aids in formulating effective treatment strategies tailored to the underlying pain mechanisms. Explain the significance of continuous self-reflection and professional development for physical therapists in the context of improving patient care. Answer: continuous self-reflection and professional development are essential for physical therapists to enhance their clinical skills, adapt to evolving evidence, and improve patient care. Significance includes quality of care. Reflective practice encourages therapists to critically evaluate their techniques, ensuring that they provide the best possible interventions based on current evidence. Adaptability. The healthcare landscape is constantly changing, and ongoing education enables therapists to stay updated on new practices, technologies, and research findings. Patient outcomes. By engaging in professional development, therapists can implement innovative techniques that may lead to improved patient outcomes and satisfaction. Ethical practice. Reflective practitioners are more likely to recognize and address their biases, leading to more equitable treatment for diverse patient populations. Engaging in self-reflection supports a culture of lifelong learning, essential for maintaining high standards of practice. A patient presents with knee pain localized to the medial aspect and reports a history of recurrent injuries during sports. How would you develop a clinical hypothesis based on the examination findings and patient history? Answer: to develop a clinical hypothesis for this patient, consider the following steps. Collect patient history. Gather detailed information about the nature of the injuries, any previous treatments, and the patient's activity level. Perform a physical examination. Assess range of motion, strength, swelling, and stability of the knee joint, paying attention to any signs of joint effusion or tenderness. Formulate differential diagnosis. Based on findings, consider possible conditions such as medial collateral ligament (MCL), sprain, meniscal tear, osteoarthritis, patellofemoral pain syndrome. Prioritize hypotheses. Focus on the most likely conditions based on the mechanism of injury and examination results, leading to a targeted treatment plan. This systematic approach promotes accurate diagnosis and effective intervention planning. Discuss how patient preferences should be integrated into treatment planning and what strategies can be employed to facilitate this process. Answer: integrating patient preferences into treatment planning is crucial for enhancing adherence and improving outcomes. Strategies to facilitate this process include shared decision-making. Engage patients in discussions about their treatment options, ensuring they understand the potential benefits and risks. Value-based conversations. Explore the patient's values, goals, and lifestyle to align treatment interventions with what matters most to them. Tailored interventions. Adapt treatment modalities based on the patient's interests, preferences, and feedback, making them more relevant and engaging. By prioritizing patient preferences, therapists foster a collaborative therapeutic relationship, enhancing patient motivation and satisfaction with their care. A 32-year-old male reports persistent low back pain that worsens with prolonged sitting and improves with movement. He has a sedentary job and occasionally experiences numbness in his legs. How would you approach differential diagnosis in this case, and what conditions would you consider? Answer: in approaching the differential diagnosis for this patient, the following steps are essential. History and physical examination. Gather comprehensive history, including the onset, duration, and characteristics of the pain, along with any associated symptoms like numbness or weakness. Consider common conditions. Based on the presentation, consider mechanical low back pain, often associated with posture and activity levels. Herniated disc. Numbness suggests possible nerve root involvement. Assess for symptoms like radicular pain. Spinal stenosis can cause worsening pain with sitting and relief with movement. Sacroiliac joint dysfunction. Pain that improves with certain movements may indicate dysfunction. Systematic reasoning. Rule out serious conditions such as infections or tumors by assessing for red flags, e.g., unexplained weight loss, fever, history of cancer.